Hi, my name is Dr. Teresa Ekman, and I've put together this education module entitled Empowered Fibromyalgia, Education to help you gain control and feel better, not just manage and cope with your symptoms. Here's a little bit about me. Who can you trust to give good information or all of the information about your diagnosis, to follow up with questions or guidance? Doctors vary in their knowledge about fibromyalgia and don't have the time to educate or guide you. It seems there is a lot of information and products available on the internet, but again, who can you trust to give you information not skewed or directly tied to their making money? I'm a researcher and educator who has put this non-biased information together for you to be armed with all of the current information to create an individual program that will empower you to feel better. I'm also a licensed professional clinical counselor and licensed alcohol and drug counselor in the state of Minnesota, as well as a person diagnosed with fibromyalgia in 1995. I conducted research on fibromyalgia for my master's thesis, which has been published, and continue to stay on top of emerging research. I have nothing to sell you, so the information is non-biased and researched through many different but trustworthy sources. Here's the course outline. In part 1, we'll look at history of fibromyalgia, current state and evolving outlook of fibromyalgia, the possible causes of fibromyalgia, including heredity, central nervous system dysfunction, psychological and emotional stress, autoimmunity, infection, and accident and injury. In part 2, we'll go over a multidisciplinary approach to treatment, taking a deeper look at sleep, exercise, digestion and immune system issues, how diet impacts our bodies, multiple chemical sensitivities and allergies, medication, supplements, mental health, relationships and stress, and personal empowerment. That's why we're here. Let's start with the history of fibromyalgia. In the early 1800s, rheumatism was a health condition which consisted of stiffness, aches, pains, tiredness, and sleep difficulties, with tender points first being described by a doctor in Scotland in the 1820s. Fibrositis was the term adopted about 80 years later, as inflammation was thought to be the cause of the symptoms. Fibromyalgia was the term adopted in 1976, as it was learned that inflammation was not the cause of symptoms. Fibra in Latin means fibrous tissues. Myos in Greek means muscles. Algos in Greek means pain, hence the term fibromyalgia. Studies prove fibromyalgia is a real medical condition. Although many thought fibromyalgia was a mental disorder or non-existent altogether, in 1981 the first scientific study confirmed symptoms and tender points could be found in the body. In 1990, the American College of Rheumatology wrote the first set of guidelines to help diagnose fibromyalgia. In 2005, the first guidelines for treating fibromyalgia pain were published by the American Pain Society. And for some insight, know that I have coached many people who were treated like they were lying about their symptoms, or treated badly by professionals who didn't believe fibromyalgia even existed. Current diagnosis criteria set by the American College of Rheumatology includes pain and symptoms over the past week based on the total number of painful areas out of 19 parts of the body, plus level of severity of the following symptoms: fatigue, waking unrefreshed, and cognitive, memory or thought problems, plus number of other general physical symptoms such as cognitive and memory problems, sometimes referred to as fibrofog, sleep disturbances, morning stiffness, headaches, irritable bowel syndrome, painful menstrual periods, numbness or tingling of the extremities, restless leg syndrome, temperature sensitivity or Raynaud syndrome, sensitivity to loud noises or bright lights, and symptoms lasting at least 3 months at a similar level, plus no other health problem that would explain the pain and other symptoms. Fibromyalgia is a chronic health problem that causes pain all over the body and other symptoms. Other symptoms of fibromyalgia that patients most often have, according to the American College of Rheumatology, are tenderness to touch or pressure affecting muscles and sometimes joints or even the skin, severe fatigue, sleep problems such as waking up unrefreshed, problems with memory or thinking clearly, depression or anxiety, or both, migraine or tension headaches, digestive problems including irritable bowel syndrome, commonly called IBS, or gastroesophageal reflux disease, often referred to as GERD, irritable or overactive bladder, pelvic pain, temporomandibular disorder, often called TMJ, which is a set of symptoms including face or jaw pain, jaw clicking, and ringing in the ears. Symptoms of fibromyalgia and its related problems can vary in intensity and will wax and wane over time, and stress often worsens the symptoms. Patients struggling with fibromyalgia experience a different kind of pain. Pain pathways throughout the body are amplified in fibromyalgia patients and can occur anywhere, so chronic headaches, visceral pain, and sensory hyperresponsiveness are common in people with this painful condition. This means a person with fibromyalgia has a very low threshold for pain, as if the volume on pain is turned all the way up, not just in fibrous tissue, but internal organs as well, creating migraines and hypersensitivity to touch, smell, sight, hearing, and taste function. There are many overlapping conditions with fibromyalgia. It's estimated that up to 80% of those with fibromyalgia also have been diagnosed with irritable bowel syndrome. Approximately 75% also have TMJ. Up to 93% also have coexisting chronic fatigue syndrome. Up to 80% also have coexisting tension and or migraine headaches. Up to 55% have coexisting multiple chemical sensitivities. Up to 21% also have coexisting bladder and or urinary problems. Approximately 32% also have restless leg syndrome. And approximately 44% also experience numbness and or tingling occurring anywhere in the body, but especially in the hands and feet. The possible causes of fibromyalgia are heredity, central nervous system dysfunction, psychological and emotional stress, immune system dysfunction, infection, accidents and or injuries. Regarding heredity, things can be inherited physically, mentally, culturally, and socially from family bloodline and family environment. Fibromyalgia could be inherited physically through genetics. About 1/3 of patients with FMS also have a close relative, usually a female, who is similarly affected. A large-scale study produced results suggesting there are 3 gene polymorphisms in fibro patients. A polymorphism of the serotonin transporter and receptor genes has been linked to fibromyalgia. There is evidence to support the COMT gene implicated in the predisposition of both pain and depression is associated with fibromyalgia. There are also links to dopamine receptor polymorphism and adrenergic receptor gene polymorphism, which are associated with pain pathways and tolerance. Regarding central nervous system dysfunction, research has found abnormal pain processing and dysfunctional connectivity of the pain network in fibromyalgia patients. Fibromyalgia patients tend to have an increase in perception of pain and a decrease of ability to sense pain, resulting in chronic pain sensitization and altered sense of heat and cold thresholds, commonly referred to as overactive nerves. Fibromyalgia patients tend to have an increase in mast cells, which are associated with inflammation. Regarding psychological and emotional stress, a number of studies have linked FMS to early sexual abuse. In addition, psychological factors have been shown to influence pain severity in fibromyalgia and may modulate the severity of perceived distress. Fibromyalgia is quite common in patients with systemic mastocytosis, a disorder characterized by a higher number of reactivity of mast cells. Emotional stress is the most common trigger of symptoms in mastocytosis patients. Estrogen increases immune and allergy response, and estradiol has a key function in pain modulation, which may account for the prevalence of fibromyalgia in women. Please join me in watching this short video on Adverse Childhood Experiences study. It explains it in a nutshell.
What does your parents' divorce have to do with your risk for heart disease? If your mother had a drinking problem when you were growing up, are you more likely to suffer from depression as an adult? Here's what you should know about ACEs. ACEs stand for Adverse Childhood Experiences, extremely stressful events that can happen to a child growing up. Some experiences are so stressful that they can alter brain development, as well as the immune system, increasing the risk of lifelong health and social problems in adulthood. The term comes from the Adverse Childhood Experiences study, landmark research that shed new light on the root cause of everything from stroke and liver disease to substance abuse and mental illness. In the late 1990s, an epidemiologist from the Centers for Disease Control and a preventive medicine doctor at Kaiser Permanente set out to understand the association between childhood experience and lifelong health. They asked over 17,000 people in the Kaiser Health Plan in San Diego about their health history, as well as difficult questions about their experiences growing up. Anda and Felitti tallied up 10 different kinds of adversity in this largely middle-class and college-educated population. They were stunned to see how common ACEs were. 21% of all respondents were sexually abused as children. 19% grew up with someone who suffered mental illness. 28% had been physically abused. And 2 out of 3 respondents had experienced at least one ACE. The researchers next looked at how someone's ACE score, or the number of adversities they experienced, related to a wide array of serious health and social problems. They saw that the more ACEs someone had, the greater their risk for poor outcomes compared with someone with no ACEs. Someone with an ACE score of 4 had twice the risk of heart disease and cancer. Someone with an ACE score of 5 had an 8 times greater chance of being an alcoholic. And those with an ACE score of 6 or more, on average, died 20 years earlier. With every major problem they looked at in the ACE study, the risk went up for each additional adverse experience in childhood. As Dr. Robert Anda says, what's predictable is preventable. It's important to remember that ACEs are not destiny. ACEs are a tool for understanding the health of a population as a whole. For individuals, an ACE score can be a tool for understanding their own risk for health and social problems, and empower them to make changes for themselves and their children. ACEs tend to get passed down from generation to generation and are common across all income levels, races, and cultures. But increasingly, people of all different professions and backgrounds are coming together to discuss how ACEs affect their communities. They're finding new ways to treat and prevent ACEs. Many doctors are starting to screen their patients for ACEs as part of their medical history. More schools are becoming trauma-informed, considering the source of problem behavior when disciplining their students, instead of immediately suspending or expelling them. To learn more about interrupting the cycle of adversity and improving health and well-being for the next generation, please visit kpjrfilms.co.
Regarding immune system dysfunction, FMS patients have been found to have higher oxidative stress index, likely causing mitochondrial dysfunction. Oxidative stress is essentially an imbalance between the production of free radicals and the ability of the body to counteract or detoxify their harmful effects through neutralization by antioxidants. While free radicals steal electrons from cells, making them unstable, antioxidants donate electrons to free radicals so they don't have to steal them, interrupting the process. Too often, however, this system is unbalanced, creating pathophysiological conditions in the body, such as gene mutations, neurodegenerative diseases, inflammatory diseases, etc. Those with rheumatic conditions such as arthritis or lupus may be more likely to develop fibromyalgia. Please watch this short video on oxidative stress.
Healthy tissue cells. Entering a tissue cell through the cell membrane. There are many elements in our body that comprise molecules. An electron from the outer bonding shell of one element forms a bond with the outer bonding second element, forming what is called a chemical bond. During oxidation, an electron can be knocked out of the chemical bond, resulting in a highly reactive free radical where an unshared electron occurred. Oxidation factors include poor diet, pollution, drugs, radiation, stress, injury, aging, and infection. Disease risk include cancer, heart disease, arthritis, autoimmune disease, and over 90 other diseases. This free radical can capture electrons from normal healthy molecules and create free radicals that damage the healthy molecules, such as molecules found in DNA. The damaged cell can release free radicals and continue the effects of oxidative stress to surrounding cells. To prevent or reverse these very destructive processes, the body constantly needs a reservoir of antioxidant molecules. Antioxidants are important in defending against free radicals. Antioxidant molecules have extra electrons and can supply electrons to neutralize free radicals. The antioxidants travel through blood vessels to reach the damaged cells. The antioxidant molecule will supply the free radical with an electron to repair and stabilize the chemical bond. In supplying electrons, the antioxidant molecules do not themselves become free radicals. Frequent healthy dosages of a variety of antioxidants will assure this destructive oxidation process will be minimized, reducing the potential for cancer, heart disease, autoimmune disease, and diabetes, not to mention their importance in anti-aging.
In regards to infection, the overuse of antibiotics can play a large part in what's happening with fibromyalgia. When a person takes antibiotics for bacterial infection, they kill both the good and the bad bacteria in their system, upsetting the delicate balance of flora needed in the intestines for proper digestion and immunity. Over time, bacteria have evolved defenses against antibiotics through the process of horizontal gene transfer, essentially teaching good bacteria to go bad. Hepatitis C, Epstein-Barr, parvovirus, and Lyme disease have also been linked to fibromyalgia. Please watch this short video on your microbiome explained.
The next time you look in the mirror, think about this. In many ways, you're more microbe than human. There are 10 times more cells from microorganisms, bacteria, viruses, fungi, than human cells in and on our bodies. And our genes are outnumbered 100 to 1 by microbial genes. Scientists even have a name for all these microbial genes, the human microbiome. Now, this might make a lot of people rush for the hand sanitizer. But it turns out most of these microorganisms aren't bad, germs that will make us sick. Most are good. And without these good microbes, our bodies don't seem to do as well. We don't seem to be as healthy, and we actually might get sick more often. So one question is, where do our microbiomes come from in the first place? Well, like a lot of things, it starts with our mothers. As the infant passes through the birth canal, it gets coated with microbes from the mom. These microbes may kind of seed the baby with just the right mix. Combined with bacteria in breast milk and other microbes we encounter early on, they seem to slowly take shape in our first few years of life. The overall mix of our microbes becomes very personal, sort of like a fingerprint or maybe a blood type. But our microbes tend to resemble those of our parents and siblings and may stay with us for much of our lives. They may also be doing all sorts of things, such as educating our immune cells, like this one, teaching them the difference between things they should fight off, bad bugs that might make us sick, and things that aren't a threat, like our good microbes. When we're adults, microbes become our first line of defense, fighting off germs that try to invade our bodies, protecting their turf while protecting our health. Scientists have discovered they can even spew out their own antibiotics. The types of microbes in your body vary depending on exactly where they live, like different ecosystems in nature. There are wet places like our mouths, noses, and armpits, oily places like our scalps and backs, and dry places like our forearms. Different species of microbes have adapted to each of these habitats. The biggest, most important microbial habitat seems to be in the gut. It's the most complex, the most diverse, and everything microbes are doing everywhere else in our bodies, fighting off infections, revving up and dampening down our immune systems, signaling cells, that's all happening in the gut in spades. They even seem to help regulate our metabolisms, how much energy we burn and how much fat we store. So if it's not functioning properly for some reason, because of what we eat, antibiotics we take, that may actually lead to all kinds of diseases. Diseases like colon cancer, colitis, maybe even diabetes and obesity. Some scientists think one reason a lot of diseases are increasing is because we've lost key gut microbes. Our microbiomes look far less diverse compared to those of people in less developed countries and earlier generations. And remember how we get our microbiomes in the first place? From our mothers when we're born and from breast milk? Well, some scientists think that too many babies aren't getting that because of all the C-sections and not enough breastfeeding, plus all the antibiotics kids get these days and our obsession with cleanliness. All this may help explain why problems like asthma and allergies have been soaring. Maybe because our microbiomes never taught our immune systems how to work the right way. Maybe swallowing good microbes, probiotics, could prevent and treat some diseases. So could taking prebiotics, essentially food that good microbes love. We end our story with a reminder. This research is really new. We still have a lot to learn about what many of our microbes are really doing. But scientists say that it's getting clearer and clearer that the tiny organisms all over our bodies are essential to our health and happiness.
In regards to accidents and injuries, fibromyalgia may be triggered by an accident or injury. Given what you just learned about psychological and emotional stress as well as infection routes of cause, this makes sense. The current state and outlook of fibromyalgia indicates fibromyalgia is estimated to affect 2 to 8% of the adult population and is considered to be the most common cause of generalized musculoskeletal pain in women between the ages of 20 and 55 years. And 80 to 90% of fibro patients are women. Most people are diagnosed during middle age, and prevalence increases with age. Mortality among adults with fibromyalgia is similar to the general population, although death rates from suicide and injuries are higher among fibromyalgia patients. Fibromyalgia patients scored an average of 4.8 out of 10 for quality of life and are 3.4 times more likely to have major depression. In regards to the economic burden, the CDC states people with fibromyalgia have approximately 1 hospitalization every 3 years and account for 5.5 million clinic visits on average per year, resulting in an average yearly direct and indirect medical cost of approximately $6,000 per person. A 2007 study found that 34% of fibromyalgia patients spend between $100 to $1,000 per month above their insurance to see a healthcare professional. Prominent fibromyalgia researchers and specialists estimate the cost in the U.S. between 12 to 14 billion each year and accounts for a loss of 1 to 2% of the nation's overall productivity. According to a 2003 published study in the Journal of Rheumatology, The total annual costs for fibromyalgia claimants were more than twice as high as the costs for the typical insurance beneficiary. The prevalence of disability among employees with fibromyalgia was twice as high as among all employees. And for every dollar spent on fibromyalgia-specific claims, employers spent approximately $50 to $100 on additional direct and indirect costs. The use of complementary and alternative medicine is 2.5 times higher in fibro patients. There is currently no test for fibromyalgia, but likely rather many tests to determine that it isn't something else than using the 2010 American College of Rheumatology criteria. There is no cure currently for fibromyalgia, but likely a focus on a multidisciplinary approach to manage physical and psychological symptoms. There is more research than ever before honing in on cause and potential treatments. In 1990, there were approximately 200 published fibromyalgia scientific research papers. Today, there are more than 4,000 published reports and many studies in progress. In this next section, we'll take a look at a multidisciplinary approach to treatment, including traditional medicine and alternative medicine approaches. Think back to the known possible causes of fibromyalgia presented in the first part of this presentation. Heredity, central nervous system dysfunction, accidents and injuries, infections, immune system dysfunction, oxidative stress, autoimmune conditions, psychological and emotional stress. Of all of those possibilities, how do you think your condition began? Of all the material presented on known possible causes, what sticks out most for you as being important and what relates to your life? Putting a Band-Aid on the problem only helps topically. We need to get at the root of the problem. A multidisciplinary approach is currently what's recommended for the treatment of fibromyalgia. What does that mean? Obtaining adjunct services and treatments from several different sources from traditional medicine and alternative medicine philosophies. Traditional medicine includes your primary care provider and any specialists such as a rheumatologist, physical therapist, or chiropractor for your physical symptoms, as well as psychiatry and therapy for your mental health symptoms, including any medications prescribed by any of these doctors. These services or medications are generally covered by healthcare insurance. Alternative medicine includes things like massage therapy, acupuncture, cranial sacral therapy, naturopathy, homeopathy, nutritional supplements, aromatherapy, Tai Chi, yoga, etc. These are things that are not generally covered by your healthcare insurance, at least in the US. Next, let's talk about sleep. Obtaining uninterrupted restorative sleep appears to be a problem for fibromyalgia, as you will recall, the criteria for diagnosis lists sleep disruption as one of the symptoms. Sleep is an active period in the body in which a lot of important processing, restoration, and strengthening occurs, correcting damage done by the previous day. If you are not getting enough restorative sleep, your body is unable to fully tend to the damage done by injuries, infections, immune system issues, or psychological emotional stress. In enhancing sleep function, you'll want to work with your doctors to get dosing instructions corrected if any of your medications make you feel tired during the day or energized in the evening. Establishing a nighttime routine and sticking to a sleep schedule, even on weekends, can be extremely helpful. This could include things like having a cup of herbal tea, cuddled up with your pet or loved ones, taking a warm bath or shower with aromatherapy essential oils, reading for an hour before turning out the light, utilizing meditation, going to candlelight after a certain hour, coloring, and etc. When this routine is established, it will send a signal to your body that it's time to wind down and get sleepy. It is recommended not to have any screen time or electronic usage during your sleep routine, as our brains can become activated and engaged, even if you fall asleep, as this leads to sleep disruption. This includes televisions, computers, smartphones, and some alarm clocks. It is recommended that the bedroom be used for sleep and sex only, without any of these electronics present. Avoid drinking alcohol before bed. It may make you sleepy, but the blood alcohol drop will wake you. Avoid drinking caffeinated beverages several hours before bedtime as well. Keeping your bedroom on the cool side enhances sleep. Also, the use of a white noise, such as an air cleaner, fan, or white noise machine, can also aid in lulling you to sleep. If you must nap during the day, set an alarm to make it brief. Exercise in the morning or afternoon if at all possible. Tend to issues arising from environmental and physical sleep issues such as partner disruptions from snoring, tossing or turning, different sleep times, needing a new mattress, needing the use of the entire bed to move around easily, additions of mattress pads and or pillows to ease pain, and removing pets from the bedroom. Next, let's talk about exercise. In the beginning, exercise can hurt and feels like it's making things worse. However, it is recommended and actually proven to help relieve symptoms in the long run. Exercise supports psychological and emotional stress and immune system dysfunction. Here are ways to gently incorporate exercise into your daily routine. Stretch your muscles before and after exercise. Perhaps your first goal of exercise can be simply to stretch daily. Ask your providers for these stretches. Have realistic goals and expectations from your body. If you haven't been able to move much, start slowly with just a few minutes of walking and add a minute as you can. Track your progress in a journal and be proud of every minute. Soreness will decrease over time. Use it as an indicator to add some time. Don't allow others to decide how or how much time you should be exercising, and don't overdo it to please others. Body movement exercise such as yoga, tai chi, or qigong have been proven for pain reduction. Next, let's talk about digestion and immune system. The health of your digestive system has a lot to do with lifestyle, as it's determined by the food you eat, the amount of exercise you get, and your stress level throughout the day, which can be inherited through family environment. What we eat plays a huge role in how we feel. Due to the evolution of what and how we eat and how we grow and package food in the U.S., the food we eat today is not the food of our ancestors. Have our bodies also gone through an evolutionary process to be able to metabolize these new forms of foods? Or are our bodies reacting to the food we are putting in it? It's an interesting question, and we'll cover it later. Did you know that most of our immune system, between 60 and 80%, is located in our digestive tract? If we are destroying our digestive tract with our diets, are we also destroying our immune system? Another interesting concept. The intestines are where our nutrients are absorbed into our system through a mucosal barrier with very tight junctions like mesh. Intestinal permeability occurs with oxidative stress, an unbalanced flora of bacteria, and when chemicals, allergens, or non-food food items are digested and allowed to cross into the body and bloodstream through holes in the mesh. This is more commonly known as leaky gut. I've selected this short video to help explain leaky gut, as well as 6 steps to heal leaky gut and autoimmune disease naturally.
Leaky gut syndrome is a condition that millions of people have and don't even know it. From the sound of it, you might think leaky gut syndrome only hurts the digestive system, but it can lead to many other health conditions. Think of the lining of your digestive tract like a net with very small holes in it that only let some things pass through. Your gut lining works as a wall to keep out the bigger pieces that can harm your system. When someone has leaky gut, the net in the digestive tract gets damaged, which causes bigger holes to form in the net, so things that usually can't pass through are now able to. Some of the things that can now pass through are proteins like gluten, bad bacteria, and undigested food pieces. Toxic waste can also leak from the inside of your intestinal wall into your bloodstream, causing an immune reaction. This leads to swelling throughout your system and causes things like bloating, food sensitivities, thyroid conditions, fatigue, joint pain, headaches, skin issues like rosacea and acne, digestive problems, weight gain, syndrome X. If left unfixed, it can lead to worse health problems like inflammatory bowel disease, IBS, arthritis, eczema, psoriasis, depression, anxiety, migraine headaches, muscle pain, and chronic fatigue. Leaky gut syndrome has been linked to other psychological disorders such as anxiety, depression, and bipolar disorder. So in many cases, if you can heal the gut, you can heal the brain. Studies show that the cause of your food allergies, low energy, joint pain, thyroid disease, autoimmune conditions, and slow metabolism could be leaky gut symptoms spreading through your body. Another problem with leaky gut is that it can stop important minerals and nutrients like zinc, iron, and vitamin B12 from being taken in. There are 4 main causes of leaky gut, including 1. Poor diet. Foods that have a lot of lectins are a bigger problem. Some of the lectins in foods that cause leaky gut are wheat, rice, spelt, and soy. While you are trying to cure leaky gut, stay away from all grains, especially those that contain gluten like wheat. Cow's milk is another food that can cause leaky gut. The component of dairy that will harm your gut is the protein A1 casein. Also, the pasteurization process will kill important enzymes, making sugars like lactose very hard to digest. Sugar is another thing that can harm your digestive system. Sugar will feed the growth of yeast, candida, and bad bacteria, which will hurt your gut even more. 2. Chronic stress. Stress weakens your immune system over time, which ruins the body's power to fight bad bacteria and viruses. This leads to swelling and leaky gut. To lessen stress, it's a good idea to get more sleep, add fun into your week, and practice meditation. 3. Toxins. We meet up with over 80,000 chemicals and toxins every single year, but the ones that cause leaky gut are antibiotics, pesticides, tap water, aspirin, and anti-inflammatory drugs. 4. Dysbiosis. One of the main causes of leaky gut is a condition called dysbiosis, which means uneven levels of good and bad bacteria in your gut. Using too much prescription antibiotic drugs, tap water with chlorine and fluoride, and the lack of probiotic-rich foods adds to the unevenness of good and bad bacteria. If you have leaky gut syndrome, you should think of trying a leaky gut diet. Here are 6 foods and supplements to heal your leaky gut. 1. Bone broth. Broth has collagen and the amino acids proline and glycine that can help heal your ruined cell walls. 2. Raw cultured dairy has both probiotics and short-chain fatty acids that can help heal the gut. Pastured kefir, yogurt, amosai, butter, and raw cheese are some of the best. 3. Fermented vegetables have organic acids that even out the intestinal pH and probiotics to help the gut. Sauerkraut, kimchi, and kvass are great sources. 4. Coconut products. All coconut items are good for your gut. The medium-chain fatty acids in coconut are easier to digest than other fats, so they work well for leaky gut. Also, coconut kefir has probiotics that help your digestive system. 5. Sprouted seeds. Chia seeds, flax seeds, and hemp seeds that have been sprouted are great sources of fiber that can help the growth of good bacteria. But if you have bad leaky gut, you may need to start out getting your fiber from steamed vegetables and fruits. 6. Supplements. There are many supplements that boost your digestive health, but the most helpful are L-glutamine, probiotics, digestive enzymes, aloe vera juice, quercetin, and licorice root.
This is a graphic I pulled from the Dr. Axe website on leaky gut and intestinal permeability. As you can see on the left, the tight junctions of the mesh have no holes. However, the junctions on the right are leaky and inflamed and do have holes, leading to particles, toxins, microorganisms going into the bloodstream, creating an immune response, which then produces nutrient malabsorption, autoimmunity, food intolerance, a blood-brain barrier breach, and systematic inflammation. Here I've pulled another graphic from the Dr. Axe website on the cycle of leaky gut. It's kind of a never-ending cycle, starting with any one of these things, but we'll start with intestinal inflammation of the gut lining, leading to nutrient malabsorption, leading to immune response, leading to GI issues and multiple food intolerances, leading to autoimmune disease, and again leading to intestinal inflammation of the gut lining. Another graphic I've pulled from the Dr. Axe website is on the leaky gut progression, starting with stress, toxins, food particles, drugs, pathogens, and organ malfunction, leading to GI inflammation and those holes in your mucosal barrier, leading to food intolerances, leading to immune system issues, and leading to autoimmunity. Leaky gut can affect your body in the following ways. Let's start with the brain. Your brain can be affected by leaky gut through manifestation of depression, anxiety, ADHD. It can affect your sinus and mouth through frequent colds and food sensitivities, as well as sinus infections and allergies. Can affect your joints through rheumatoid arthritis, fibromyalgia, headaches. It can affect your adrenals through adrenal fatigue. It can affect your colon through constipation, diarrhea, or irritable bowel syndrome. It can affect your thyroid through Hashimoto's, hypothyroidism, or Graves' disease. It can also affect your skin through acne, rosacea, eczema, and psoriasis. Next, we're going to morph into GMOs from leaky gut by talking about the biggest food offenders for leaky gut being grains, dairy, sugars, yeast, and genetically modified organisms. Agriculture is a big business aimed at growing food faster, bigger, and cheaper to make the most profit and to address the issue of sustainability among the world's inhabitants. Therefore, farmers are using genetically modified organisms, known as GMOs, to produce plants that are herbicide and pesticide resistant, as well as chemical fertilizers that improve the soil, creating an entirely unnatural ecosystem. Most developed countries do not consider GMOs to be safe, but there are arguments for both sides of the issue. As a result of these farming practices, as well as acid rain, our soil has become depleted of needed vitamins, minerals, and microorganisms and nutrients over time. Food intolerance and digestion issues have been linked to the use of GMOs. High-risk GMO-containing products include alfalfa, corn, flax, rice, sugar beets, yellow summer squash, canola, cotton, papaya, soy, zucchini, and wheat. There are many ingredients derived from these products, such as amino acids, aspartame, which nobody should be consuming at this point because it's linked to cancer and Alzheimer's, ascorbic acid, sodium ascorbate, vitamin C, citric acid, sodium citrate, ethanol, flavorings, both natural and artificial, high fructose corn syrup, hydrolyzed vegetable protein, lactic acid, maltodextrins, molasses, monosodium glutamate, sucrose, textured vegetable protein, xanthan gum, vitamins, and yeast products. The following animal derivatives are also considered high risk due to the potential GMO contamination in feed and other inputs: milk, meat, eggs, honey, and other bee products. In an effort to make that simpler, let's just focus on these 4 foods. Grains. It is almost difficult to find food without wheat as an ingredient these days, and gluten intolerance has been on the rise. As you can see, rice, flax, corn, alfalfa, and soy are not healthy alternatives unless certified GMO-free. Remember, many of these foods are also sprayed with chemicals. Dairy. Many people are lactose intolerant, and lactose is just a natural sugar. Dairy farmers commonly use antibiotics and hormones in their cows, which are then passed into the milk. Dairy farmers commonly feed their cows with GMO products, which gets passed into the milk we drink. Sugar. Many people do not understand that there are high natural sugar content in fruits and vegetables, which can aid in wreaking havoc in your system, not to mention processed sugar, high fructose corn syrup, and sweeteners. While fruits and vegetables are healthy to eat, GMO and chemical-free, processed sugars and chemicals are chemicals themselves. It's difficult to find food without some form of sugar as well. Yeast. Used to make bread, crackers, sweet treats, etc. The problem is naturally occurring yeast in your digestive system feed off dead yeast, which are normally mixed with flour in the grains, sugar, and or dairy, and proliferate out of control. Yeast's favorite food is sugar. In the following videos, we'll take a look at how carbohydrates impact your health and how the food you eat affects your gut.
Which of these has the least carbohydrates? This roll of bread, this bowl of rice, or this can of soda? It's a trick question. Although they may differ in fats, vitamins, and other nutritional content, when it comes to carbs, they're pretty much the same. So what exactly does that mean for your diet? First of all, carbohydrate is the nutritional category for sugars and molecules that your body breaks down to make sugars. Carbohydrates can be simple or complex, depending on their structure. This is a simple sugar, or monosaccharide. Glucose, fructose, and galactose are all simple sugars. Link 2 of them together, and you've got a disaccharide: lactose, maltose, or sucrose. Complex carbohydrates, on the other hand, have 3 or more simple sugars strung together. Complex carbohydrates with 3 to 10 linked sugars are oligosaccharides. Those with more than 10 are polysaccharides. During digestion, your body breaks down those complex carbohydrates into their monosaccharide building blocks, which your cells can use for energy. So when you eat any carbohydrate-rich food, the sugar level in your blood, normally about a teaspoon, goes up, but your digestive tract doesn't respond to all carbohydrates the same. Consider starch and fiber, both polysaccharides, both derived from plants, both composed of hundreds to thousands of monosaccharides joined together, but they're joined together differently, and that changes the effect they have on your body. In starches, which plants mostly store for energy in roots and seeds, glucose molecules are joined together by alpha linkages, most of which can be easily cleaved by enzymes in your digestive tract. But in fiber, the bonds between monosaccharide molecules are beta bonds, which your body can't break down. Fiber can also trap some starches, preventing them from being cleaved, resulting in something called resistant starch. So foods high in starch, like crackers and white bread, are digested easily, quickly releasing a whole bunch of glucose into your blood, exactly what would happen if you drank something high in glucose, like soda. These foods have a high glycemic index, the amount that a particular food raises the sugar level in your blood. Soda and white bread have a similar glycemic index because they have a similar effect on your blood sugar. But when you eat foods high in fiber, like vegetables, fruits, and whole grains, those indigestible beta bonds slow the release of glucose into the blood. Those foods have a lower glycemic index, and foods like eggs, cheese, and meats have the lowest glycemic index. When sugar moves from the digestive tract to the bloodstream, your body kicks into action to transfer it into your tissues, where it can be processed and used for energy. Insulin, a hormone synthesized in the pancreas, is one of the body's main tools for sugar management. When you eat and your blood sugar rises, insulin is secreted into the blood. It prompts your muscle and fat cells to let glucose in and jumpstarts the conversion of sugar to energy. The degree to which a unit of insulin lowers the blood sugar helps us understand something called insulin sensitivity. The more a given unit of insulin lowers blood sugar, the more sensitive you are to insulin. If insulin sensitivity goes down, that's known as insulin resistance. The pancreas still sends out insulin, but cells, especially muscle cells, are less and less responsive to it. So blood sugar fails to decrease, and blood insulin continues to rise. Chronically consuming a lot of carbohydrates may lead to insulin resistance, and many scientists believe that insulin resistance leads to a serious condition called metabolic syndrome. That involves a constellation of symptoms, including high blood sugar, increased waist circumference, and high blood pressure. It increases the risk of developing conditions like cardiovascular disease and type 2 diabetes. And its prevalence is rapidly increasing all over the world. As much as 32% of the population in the US has metabolic syndrome. So let's get back to your diet. Whether your food tastes sweet or not, sugar is sugar, and too many carbs can be a problem. So maybe you'll want to take a pass on that pasta, sushi roll, pita burrito, donut burger sandwich.
Trillions of bacteria, viruses, and fungi live on or inside of us, and maintaining a good, balanced relationship with them is to our advantage. Together, they form the gut microbiome, a rich ecosystem that performs a variety of functions in our bodies. The bacteria in our guts can break down food the body can't digest, produce important nutrients, regulate the immune system, and protect against harmful germs. We don't yet have the blueprint for exactly which good bacteria a robust gut needs, but we do know that it's important for a healthy microbiome to have a variety of bacterial species. Many factors affect our microbiomes, including our environment, medications like antibiotics, and even whether we were delivered by C-section or not. Diet, too, is emerging as one of the leading influences on the health of our guts. And while we can't control all these factors, we can manipulate the balance of our microbes by paying attention to what we eat. Dietary fiber from foods like fruits, vegetables, nuts, legumes, and whole grains is the best fuel for gut bacteria. When bacteria digest fiber, they produce short-chain fatty acids that nourish the gut barrier, improve immune function, and can help prevent inflammation, which reduces the risk of cancer. And the more fiber you ingest, the more fiber-digesting bacteria colonize your gut. In a recent study, scientists exchanged the regular high-fiber diets of a group of rural South Africans with the high-fat, meat-heavy diets of a group of African Americans. After just 2 weeks on the high-fat, low-fiber, Western-style diet, the rural African group showed increased inflammation of the colon as well as a decrease of butyrate. That's a short-chain fatty acid thought to lower risk of colon cancer. Meanwhile, the group that switched to a high-fiber, low-fat diet had the opposite result. So what goes wrong with our gut bacteria when we eat low-fiber processed foods? Lower fiber means less fuel for the gut bacteria, essentially starving them until they die off. This results in less diversity and hungry bacteria. In fact, some can even start to feed on the mucus lining. We also know that specific foods can affect gut bacteria. In one recent microbiome study, scientists found that fruits, vegetables, tea, coffee, red wine, and dark chocolate were correlated with increased bacterial diversity. These foods contain polyphenols, which are naturally occurring antioxidant compounds. On the other hand, foods high in dairy fat, like whole milk, and sugar-sweetened sodas were correlated with decreased diversity. How food is prepared also matters. Minimally processed, fresh foods generally have more fiber and provide better fuel. So lightly steamed, sautéed, or raw vegetables are typically more beneficial than fried dishes. There are also ways of preparing food that can actually introduce good bacteria, also known as probiotics, into your gut. Fermented foods are teeming with helpful probiotic bacteria like lactobacillus and bifidobacteria. Originally used as a way of preserving foods before the invention of refrigeration, fermentation remains a traditional practice all over the world. Foods like kimchi, sauerkraut, tempeh, and kombucha provide variety and vitality to our diets. Yogurt is another fermented food that can introduce helpful bacteria into our guts. That doesn't necessarily mean that all yogurt is good for us, though. Brands with too much sugar and not enough bacteria may not actually help. These are just general guidelines. More research is needed before we fully understand exactly how any of these foods interact with our microbiomes. We see positive correlations, but the insides of our guts are difficult places to make direct observations. For instance, we don't currently know whether these foods are directly responsible for the changes in diversity, or if something more complicated is happening. While we're only beginning to explore the vast wilderness inside our guts, we already have a glimpse of how crucial our microbiomes are for digestive health. The great news is, we have the power to fire up the bacteria in our bellies. Fill up on fibers, fresh and fermented foods, and you can trust your gut to keep you going strong.
Next, let's talk about multiple chemical sensitivities. Your body is likely producing and or reacting to the toxins you eat and the toxins you are exposed to daily, adding to your leaky gut, oxidative stress, and psychological or emotional distress. Think about all the chemicals you come into contact with on a daily basis. All your personal products, the cleaning products in your home, stain-resistant carpet and or furniture, possible mold, smoke, radon, and city water, the exhaust and pollution on your way to work, the chemicals in your vehicle, more cleaning products and stain-resistant fabrics at work, along with copier and fax chemicals and inks, and with the addition of everyone else's personal products. Many people work directly with toxic chemicals. If you are hypersensitive to smells and have frequent headaches or migraines, your body is likely overloaded with toxins. Next, let's take a look at the medications that are approved to treat fibromyalgia. There are currently 3 medications currently on the market approved to treat fibromyalgia. Lyrica, an anti-seizure medication aimed at treating overactive nerves. Cymbalta, an SSNRI, selective serotonin norepinephrine reuptake inhibitor, antidepressant, which also treats pain by positively affecting communication between the nerve cells in the central nervous system and or restoring chemical balance in the brain. And Savella, an SNRI, selective norepinephrine reuptake inhibitor, not approved in the US as an antidepressant. Of note, opiates have been proven not to be therapeutic for fibromyalgia and can actually make symptoms worse. Other commonly prescribed medications include antidepressants in general, and particularly duloxetine, which is Cymbalta, and the tricyclic amitriptyline have been proven to alleviate symptoms. Gabapentin, prescribed for pain, has been proven to alleviate symptoms. Cyclobenzaprine, a muscle relaxer, has also been proven to alleviate symptoms. And other over-the-counter pain meds such as Tylenol, Aleve, and Advil for symptom control. Commonly used supplements include melatonin for sleep, omega-3 fatty acids for inflammation and brain function, probiotics for developing a healthy flora of bacteria in the digestive system. Vitamin D has shown to improve symptoms if deficient. Magnesium for headaches. Antioxidants in general. CoQ10 and L-carnitine were found to improve symptoms. Quercetin and luteolin are flavonoids, which have anti-inflammatory, antioxidant, anti-allergic, and antimicrobial properties, and aid in decreasing mast cell prominence, and have promising research. Other useful therapies include chiropractic care, massage therapy, physical therapy or occupational therapy, craniosacral therapy, water therapy, acupuncture or acupressure, mindfulness meditation, and warm, cold compress or topicals. As you will recall, it has been found that many people diagnosed with fibromyalgia have experienced trauma in their life, either early childhood sexual trauma or have suffered trauma from an accident or injury. Depression is the #1 mental health diagnosis among fibromyalgia patients, 3.4 times more likely than the general population, due to the quality of life. Anxiety and PTSD are also likely to be present in those with a history of trauma. Your mental health therapist and psychiatrist can help you feel better by balancing your brain chemistry through the use of medication, as well as exploring or discovering new methods and tools to cope with and manage past, present, and future life experiences. Moving to relationships and stress levels. Of 1,228 fibromyalgia patients surveyed in the U.S., 85% report that pain is the symptom that most impacts their daily life. 55% report that pain has negatively impacted romantic relationships. 68% report their pain has affected physical intimacy with a partner or spouse. And 72% report that they are hesitant to plan activities out of fear that they will have to cancel due to their pain. Therefore, being able to communicate effectively with your coworkers, friends, and family are of utmost importance. Working with your mental health therapist can help aid you in doing so for the best possible outcome. In a survey of 2,559 fibromyalgia patients, 9 in 10 report they no longer feel they are the same person. 92% reported their pain condition has had a significant impact on their major life decisions, such as having children, moving to a new location, changing roles and jobs, staying physically active, instigating or remaining in a relationship, while 63% asked for more help from family or friends. 48% approached intimacy with their partners differently. 44% feel their loved ones don't take their condition seriously. And 1/3 reported professional relationships are adversely affected, with only 1/4 of their colleagues understanding their condition. Therefore, becoming part of a support group network can help you gain strength in knowing you are not alone, that others have similar experiences and may have helpful ideas. Having healthy, realistic expectations and being able to communicate that to your loved ones is key. Expectations of self and others. Nobody can determine what you're capable of physically or mentally. Honor your body by listening to it, being kind to yourself by balancing internal and external expectations with what is truly possible. Pushing yourself a little while you are trying new things is good, but overdoing it will make it less likely you'll try again and end up in a flare-up. It's not helpful to anyone. no matter how hard or how much you want to help, do, or try. An excellent way to plan for balance is making use of a planner. When you are able to look at your week or month planned out with your daily routine, events, projects, etc., you and your support system can better see where balancing will need to occur. Incorporate time for all life aspects in a consistent way: family and friends, home, work, community, spirituality, health, etc. If all you can manage to do in a day is go to work, for instance, you will need to ask for assistance with some of your other life aspects. Schedule accordingly on days you don't work, or lessen the amount of time you work. Making use of food and exercise journals are an excellent way to keep track of what you're eating, restricting, trying, doing, etc., and how it makes you feel. Journaling in general can help you process your feelings about having fibromyalgia. Of 1,228 adults surveyed in the U.S., only 45% report they are discussing the actions they have taken to try to improve their pain daily with their primary care physician. 30% report they are addressing management strategies such as setting and tracking goals. And studies have found that patients have significantly more improvement with educational intervention. None of us signed up for this, and there is no manual. It's likely you have been experiencing emotions of anger, sadness, frustration, and resignation. I understand your physical and emotional pain personally. However, I can tell you it can get better by applying the information supplied in this education module to your life. And if you need more assistance, please look through my website at www.empoweredfibromyalgia.com. Thank you.